Live right now. Hello, everyone. Welcome. I am Christina Joy. I'm representing Sankofa Video and Books and Cafe in Washington, D.C. We are located at 2714 Georgia Avenue Northwest, right across the street from Howard University. HU, you know. um, and have the lovely privilege of interviewing Linda Villarosa tonight, author of Under the Skin, the hidden toll of racism on American lives and the health of our nation. And Linda Villarosa is a journalism professor at the City University at CUNY and a contributing writer at the New York Times Magazine, where she covers the intersection of race and health. She also served as the executive editor at Essence and as a science editor at the New York Times. Her April 2018 article on maternal and infant mortality was a finalist for a National Magazine Award. She's a contributor. She's a contributor to the 1619 Project. And Linda, can you share what you just shared with me about the book about Under the Skin, because it came out last year, June 14th, right?
June 14th. And this year it got named one of the New York Times top 10 best books of 2022. So, woo,
Oh,
I hope I don't sound braggy, but I'm super happy, so I can't even control myself.
no, please celebrate yourself, a black woman, okay? Because we too often are like, oh, they gave you this thing, and I guess it's cool or whatever. No, it's really cool,
It's
actually.
really cool.
It's really cool. That's something to celebrate. Thank you for sharing that as well. And it's funny, actually. Uh, we have a lot in common because you actually work with one of my oldest friends, my friend Adrienne Green. Uh
Oh,
she works at the Times
I
magazine.
just worked with her on a story. It was really
Yeah,
wonderful. Yeah, I hadn't met her before, and we just like this now.
yeah, yeah. She literally we went to middle school together. So we went to middle school and high school together, and we've been friends ever since. Like, so it's just so funny, like how our lives have kind of
Yes,
parented very different ways. I'm actually a social worker. I just got my MSW last year from Howard. Oh, I know it froze a little bit. You're right. You're with me. Okay. So I got my MSW last year from Howard. I actually went to undergrad at Howard as well, for
excellent.
psychology. And so health and like mental health and public health have been like things that I've really been interested in. And ever since I read your article back in 2018 about the Black maternal health crisis, that was really what sounded the alarm in my head. I was like, whoa, like it blew my mind. I couldn't even, I had no idea. I was 3 years out of undergrad at that point, and I was just working in bookstores and just trying to figure out how am I getting to grad school. And then that article came out, and I was like, whoa, like shook me to my core, to the point that in grad school I researched a lot more about it, and like wrote policy papers on it, and like looked up different policies that are helping black moms, like the Black Mom to Miss bill. So you really like you really impacted me. So this is like a really nice moment to have, being able to interview you about this book, because I didn't know that, when I started working at Sankofa, I had no idea that you were going to come out with a book until we actually were, we were shipped this galley, and I was like, oh my god, I love this woman. It's like, let's do an event with you, and here I am today. So I'm very excited to talk to you. And so I guess my first question is about, in regards to this book. What did you want people to get out of this? Because this is a really comprehensive book. It covers a lot of topics relating to our health, relating to different forms of injustice that we face that we don't even know about. But and it feels like it's it feels just like a rallying cry, the whole book. So what was the biggest what is the biggest thing you wanted people to take out of this book?
Well, I think, well,
Oh,
thing you said. I think what I wanted to, I've shifted
mm, my goodness.
convey. End goal was to change the system.
Mm,
Harm. And I think physicians and other healthcare providers, I don't necessarily think it's their individual fault, but there's a systemic problem. So I wanted to change that, starting with medical students and all the way through medical training and practice. And that was my goal. And I thought, oh, I'll just speak to groups who are like medical schools and stuff. Then my daughter came with me to a couple of events. And what she said was, you are also lifting the stories of the harm that's happened to people, because often we're, told that, and even me and my own family, no, nothing's wrong. It's you. You're doing something wrong. It's your fault. Something's wrong with you. You didn't, something happened to you, but it's on you. And what I'm trying to say is, no, it's not on us. Something is going on in society and in the healthcare system itself that, is affecting us, our bodies, and minds as Black people. And so I think my daughter pointed out, you have to say that. You have to say, you're not insane. There is something often sinister going on and happening to us.
absolutely. I wholeheartedly agree. I feel like your book is really like America's been gaslighting you your whole life. And here are all the receipts. That's what
I love it. I'm taking that. I'm going to start saying that.
it's so isn't it so true because there's so many stories like particularly I love how like especially like how with each story you bring a personal account to each issue. And so even with yourself, talking about maternal health, you used your own maternal health as an example. Can you talk a little bit more about that?
Well, I think it's so interesting that I'm doing this tonight, because this morning I did a grand rounds, which means that I'm talking to the doctors at a hospital, and it was the hospital where my children were born.
Oh wow.
So I was at once saying, thank you. I have two healthy children, but also something happens to us. And my own physician, who I love, organized the talk, and she delivered both my kids. And it was interesting talking to the doctors to say, something happened to me. And it wasn't even about the care I received. Like, I had great health care, I had a great physician, but I entered into the system with a problem that usually is affect people who really use drugs, who drink during pregnancy, who are quite ill, that something's wrong with them. So I said something about my lived experience had me enter the healthcare, the OBGYN system, pregnant with my first kid, who was way too small inside of me. I was put on bed rest. I was sent to a perinatalogist,
Mm.
and that was the sort of medical part that wasn't so good with me, where this was outside of my regular OBGYN. I go to the specialist who just takes me through this catalog of, did you use this drug? Did you eat this? Did you do this? Everything about me and something I did wrong, including, did you use crack cocaine? Like, I was like, I'm the health editor of Essence. I'm not using crack cocaine. I know what to do. I want to have a healthy baby, but why am I having to explain this? And then my baby was born she was just 1 day short of preterm.
Mm.
Basically, we held on so that she wouldn't get that designation. But
Right.
she was 4 pounds, 13 ounces,
Mm.
tiny, by any measure. Look at my cat up here trying to get in it. Um, I never understood why. And I started thinking, is there something about me being a Black woman in America, having to deal with, discrimination my whole life, that affected my own childbirth? And that was one of the first times I started to think about it and to loop in my own experience in sort of my thinking.
Right. Because that's it's I know friends that were low birth weight when they were, uh born. Like one of my friends actually was premature, and like it was like a dire situation. They had to actually take him in a helicopter to a whole another hospital because he was that severe. So it's like, and today he's dancing at Disneyland in Paris, but like
Exactly.
he's healthy and everything now, but that was a whole thing. And like there are too many stories of Black women um suffering in labor and delivery, suffering throughout their pregnancy, suffering like with and without advocates. And a lot of us didn't even know that we needed advocates in the first place.
That's exactly true. And one of the things in the book I share is the Black Women's Health Study. So the Black Women's Health Study is wonderful. It's this, it's out of Boston. It was supposed to be an anecdote to the Nurses' Health Study, which, even though so many Black women are nurses, the Nurses' Health Study was 97% white. So they started this Black Women's Health Study. And it was very interesting because most of the researchers behind the scenes in the Black Women's Health Study of 60,000 Black women are white.
Mm.
And when they first started, they were in their 30s and they were all having their babies at the same time. And then they noticed that there was the one Black researcher. They're all at the same educational level. They're all at these elite institutions in Boston. And the one Black woman was the one who had a difficult pregnancy. Her baby ended up in the NICU. And so then they started thinking about it. And they said they added questions about racism to the Black Women's Health Study for the first time in they did it in the 90s. So they were very early with this. And I was really impressed with that they made, white women who were behind the scenes said, wait a minute, something's wrong here. And they did it because of the experience of their Black colleague.
Right. And I'm sure seeing it in real time really like woke them up. Like, maybe like, especially because there are too many pregnant people here, there has to be something going on with you. If you're about the same type of health,
exactly. We're all doing the same thing. We have the same level of education and knowledge, and we're all like health professionals, basically. They're PhDs. And so it was very interesting, but sad that, I interviewed her and she said her son is fine, but that was scary when he was in the intensive care unit.
Right. Right. Now, I will say something I didn't know much about before I read this book was a lot about environmental justice. I feel like it was something I've been made aware of more recently, but like not to the extent in which you go into this book. Can you elaborate on Danielle's story and that whole chapter just was
I know. If you can believe this, because my book came out on June 14th, sometimes it was packaged as a beach read. I'm like, who would take this book to the beach? No.
I was in tears. I'm like, oh my God, this was just, I mean, the way you take us through her life and these people who live by this lake. And I'm just like, I don't understand.
I know. So I met Danielle Bailey Lash in, I guess it was I was working on the book. So it was like in 2019, I think. And she was at a conference speaking at, Al Gore's reality, I can't remember what it's called, but it's like his environmental rights and, environmental issues conference. And so, I mean, this was like the whitest thing ever. And so anytime there was anyone Black, I was like running over to go to the panel or talk to them. And so there was a panel and Al Gore was on it and some other sort of dignitaries. And then there was this Black woman and she was wearing this turban. And so I was super interested in her. So I'm listening to her and she gets up and she speaks in the most halting way. And it turns out she was wearing the turban because she had brain cancer and she had lost her hair. And she was also on like a machine that was helping her deal with the brain cancer.
Yeah.
And she spoke in such a beautiful way, but she completely blamed herself about how she got cancer. But it was an environmental conference. So, she was also talking about this really polluted lake that she lived near and that she was doing advocacy for the first time and standing up and talking about brain cancer and talking about all of the people that got brain cancer, the people that lived closest to the lake who were Black in this community were many of the ones with the cancer. And even white people that lived near the lake, had different kinds of cancer. And then I was watching her and I was really moved by her story. And then there was this white woman in the audience who was just like super latched onto her. And then after she finished, the white woman went and helped her with her, helped her sort of get off the stage. So I asked if I could interview the two of them together because I'm like, like this level of friendship was really beautiful. So Danielle told me her story, and her friend Caroline said how she was the person who alerted Danielle to the danger of where they lived in North Carolina, by this lake and the land polluted by Duke Energy. Duke Energy was sued. It was proven that it was causing a problem. So I interviewed them. I stayed in touch. And then about 6 months later, I got an email from Caroline, and she told me that Danielle had passed. So then I felt really bad that I hadn't, gone to see exactly where she lived. So Caroline, I went to North Carolina, and Caroline took me to all the places where Danielle lived. I got introduced to her mother. I saw the lake. I saw everything. I saw these landfills that were there, and they were always minimized. So I told the story, and then she finally took me to Danielle's gravesite, and Caroline was a mess. She's was crying, but she also talked about how she did artwork in memory of her best friend.
Right.
And I just had to include that story because it really illustrated environmental racism and why we as Black people are 75% more likely to live near a polluting facility. But it also was this story of friendship, which I really appreciated.
Right. And then it's like when you really think about it, like, and you think about Black neighborhoods that you've seen and grown up around, there are chimneys of smoke coming out with foul smells, and whatever knows what it is. And
It's true. And it's always minimized. And I did a story for the Times magazine about this community in Philadelphia. And the story started about Black children and asthma. So I go to this school, and there's all these little asthma canisters at the school. There's so many at the Black school. Then I go to the homes of the people, and they're learning ways to minimize asthma, like get rid of the cat, vacuum, look at mold. And then I'm thinking, oh, this is really great. And then I'm looking out the window, and there's this giant there's a giant refinery in Philadelphia. It's since been closed. But I'm looking at it, I'm going, well, you can do these minimizing, issues, and it's really good. Learn how to use the asthma inhalers, learn how to, minimize the kind of asthma triggers. But the biggest asthma trigger is right out the window.
Right.
And so I kept thinking about that, and nobody was talking about it. And so it was took me a year and more to report because it was hard to get the science of it because, the science just wasn't there because people were more looking at these micro ways to minimize the risk and not looking at this big, horrible refinery.
Meanwhile, it seems like with the evidence that you pulled up, they are well aware of what they're doing.
And have been aware for a long time. And Black people have been part of created the environmental justice movement and have been advocating for ourselves, even though, we don't get the kind of credit we deserve. Thus, the, Climate Reality Conference is mostly white folks, even though we were the, originators, unfortunately, of the environmental justice movement by need and necessity.
It's mind blowing to me. It's mind blowing to be honest. We have a comment from the audience saying that thank you for sharing your research with us. Environmental injustice is real. Thank you, Mitzi, for your comment. Yeah, it was really something. You're absolutely right because whenever I think of any images of environmental injustice, it's always hippie white folks on these sitcoms and TV shows and whatever, like who are fighting the power and hugging trees, and like it's perceived as a completely white activism space, like and it's I've never really seen too any images of Black people like taking up the fight for injustice, except now because of social media. Like,
That's right. Exactly. Through social media. Thank goodness for it, because we can show that we are part of the solution. We are a part, and we have been doing it for a really long time. So I really appreciate, that it's being lifted up now.
yeah, me too. Something I really liked about your book is that you you emphasize the point that poverty is a major factor, but that the race problem is like the overall and the overarching problem, and that across all socioeconomic statuses for Black folks that we are at risk in each of these areas that you discussed. And it feels very intentional. Can you elaborate on why?
It's so intentional. And thank you for noticing, because I'm really obsessed with that.
Yeah.
Because when I go out and talk about the racial health disparities, and it starts at infant mortality at birth, and
Mhm.
maternal mortality, and goes all the way to life expectancy. So why do we have so few, why is it do we live fewer years, and why do our babies die, and birthing people die more often? So we're always blamed, or it's a genetic issue. So that's why I'm super intentional about this, because it's sort of like, well, it's because so many people are poor and you lack access to healthcare. And it's interesting, because if you're talking to physicians, they say, well, it's because of a lack of access to healthcare. You're talking to real people, and it's like, well, I have access to healthcare, but I don't like going into the system because it's harmful to me. Or when I do go into the system, I don't get the care and treatment I deserve. So
Yeah.
that's what I was super interested in, this disconnect. And what really I became obsessed with, and it's kind of like what you were talking about with my why America's Black mothers and babies are in a life or death crisis, was the statistic was about maternal and infant mortality. And it said a Black woman with an advanced degree is a JD, MD, PhD, MS, like I have, is more likely to die or almost die or lose her baby than a white woman with an eighth grade education. And if you look closely at the statistics, the disparity is greater at the more educated end.
Mm,
So, education is a proxy for me for having access to healthcare, for knowing exactly what you're supposed to do when you're pregnant, for
right.
taking good care of yourself, for having the resources to eat well, to take prenatal vitamins, to have a good hospital, to or whatever, wherever you're going to deliver your baby. So why would the discrepancy be greater in more educated people when the only difference is education? And so that didn't make sense to me, and it just screamed so wrong. So that's why I really took that deep dive into maternal and infant mortality, to look at, wait a minute, this is something wrong, and the statistics are right here. And then, the other statistics are a compilation of people's lived experiences, including my own, and
Right.
people that I know and care about. And so I started thinking, wait a minute, when the thinking is off, that is where journalism often comes in to sort of illuminate these issues. And somebody like me, who's really been in the Black space my entire career, I
Right.
felt like, oh, I'm the person to do this.
Right. And especially because it started with like the whole teenage pregnancy BS that was going on in the 90s and 80s. Like, oh, Black girls are driving up the poverty rates because they're out here getting pregnant at alarming rates, and God help these Black girls. And it's like, no, actually,
And
that's not.
that is the work of Arlene Geronimus, who I consider a mentor to me. She
Mhm.
coined the term weathering. Weathering is the concept where the lived experience of being Black in America, especially a Black woman, is harmful to the body because of the micro and macro aggressions cause a kind of premature aging. So please look out for Arlene Geronimus's book Weathering, which is coming out on March in 20 this year.
Oh,
And but in the past, Arlene was completely dragged because of the idea that because she found out that infant mortality rates in Black people did not happen because of teenagers. It happened later. And her contention was it happened later in the late 20s and 30s because of you've had longer to deal with discrimination, and it harmed the body and it caused the premature aging where teenagers hadn't had it as bad.
Right.
And actually, middle people that were in predominantly white spaces were the ones that were having it worse. And Black communities that were assumed to be poor were actually protective.
Right.
And so, and she got, in trouble by
Right.
mainstream because it looked like she was sort of
Glorifying.
condoning teen
Yeah.
pregnancy when
Yeah.
she was actually saying something different.
Right. Right. And that's often how our research is looked at, right? Like, oh, it's fanciful and this is outlandish and this couldn't possibly have happened. What measures did you use? This is bias. But meanwhile, you show evidence of how they have spun this web of lies for years to substantiate racism in psychological and physical in any type of way with actual research behind it.
Yeah, that is completely right. And I think, my kind self is like in today's world, I don't think people do it intentionally like they did it in the past. I was part of the 1619 Project. So I looked at the way white doctors in the South were really making up stuff, just using myths and false ideas and false assumptions in order to justify enslavement and all the cruelty that went with it. And I was actually shocked. I was like, hello, I've reported on a lot of negative stuff, but this in the past, the lies they told in order to make money off of our bodies and our lives and our children and buying and selling bodies was shocking to see because it was a lie. And then sometimes when I talk about those myths in, discussions of 1619, people laugh because they're so absurd. But it's like, you know what? This was in a medical journal at the time. This guy was at Tulane. He was owning enslaved people, but he was also a professor at Tulane. This was in a medical journal. This was in a medical conference. And people he was believed because of his legitimacy as a scientist and somebody else as a physician. And it was funny because at the conversation at Mount Sinai today, I was talking about J. Marion Sims, who was the so-called father of modern gynecology. People still use the Sims speculum that
Right.
was named after him. And, it was later discovered through his own writing that he tortured enslaved women to perfect gynecological surgeries. So I was saying this, and somebody's microphone accidentally went on in the discussion, these doctors at Mount Sinai Hospital in New York. And I heard the person say, hey, look at how she's pulling out the truth about your boy, Sims. And I love that there's this Black person saying, look, your boy Sims was doing harm. You're so worship him. And then it got shut down really quickly. I was like, yeah, we have to tell the truth about these people and not
Right.
revere them. His statue was taken down in New York, but it's still up in Montgomery, Alabama, where he did most of his practicing.
Mm, mm.
Hot mic.
That's a hot take on the hot mic. Like that's a whole mess. I mean, it's true. We've been taught that these are the founding fathers of each discipline, and they've done all this great research, like how Darwin is still lauded, like a lauded psychologist, and I'm just like, this man said that our brains were small, our skulls are smaller because we're dumber. Like, are you kidding me? Like, why
That's
is
right.
he still the standard?
That's right. And it was interesting because I got into this conversation where I was talking about J. Marion Sims, and I was telling how his statue got taken down out of Central Park,
Right.
partially due to the activism of people dressing up like Anarcha, Lucy, and Betsy, the enslaved women he tortured, with a blood-stained, paint-stained gown, and protested day in and day out to get that statue taken down. So then it turned into this, conversation about, well, do you believe that statues need to be taken down? I was like, I'm not talking about that. I am talking about this person, and don't lose focus here. His
Right.
statue is still up in Montgomery, Alabama. You
Right.
know, now
Right.
there's counter statues, counter artwork about, against his work, which I love. And I'm like, no, you cannot drag me into a conversation about whether all statues of people who've
Right.
been harmed.
Right.
I'm not, but I really am focused on this guy.
Right.
Get all of his statues down.
Right, because at the end of the day, these statues, they've been here. They've had their mark. These people have already imprinted on all the industries that have been affecting us, and it's still here. It hasn't gone anywhere, and that's the whole point. Is
Yeah.
that they're still wrong, and y'all are still talking about them as if they're
Yeah.
right.
Yeah, that's the problem. And we shouldn't be celebrating this man. And, I mean, maybe we'll still use the sim speculum in gynecological care. Maybe they
Right.
want to change the name of that. But the point is that it's important to understand the history and make our decisions ourselves, but to know the truth.
Absolutely. Absolutely. And so I something that had come up, what or something that stuck out to me, was that conversation you had with a white colleague, because you had mentioned how, like, there are so many Black organizations dedicated to health, to uplifting our health, and to, like, you, even yourself, you, in essence, you were fighting the good fight of self health, and preaching, you got to do this at home, and share this with all of our brethren, like, let's get our health together. And we do have this attitude of, like, we have to take care of ourselves, which is, like, our a part of our culture, a part of our community. But the comment that the your white colleague said was that this should be an American problem. Like, where
Yeah.
do you stand on that?
And I never ever thought of that. I just thought it didn't even occur to me that we had the agency to ask for this at the time, because I was just really in the trenches at Essence, just saying, we got to do this. This is for us, by us. This is us helping us. This is saving ourselves. These are the things that we have to do. This is about, for me, Black women taking care of our health and taking care of ourselves. It never occurred to me that this would be, like something that America as a whole would come, stand up for. And I think it took a change in my own thinking to say, and to look at the statistics, because if you look at our stats as a country, and I don't just mean the Black stats, I mean the American stats, we are the richest country. We spend more on healthcare than any other countries, yet we have the worst health outcomes as a nation. In infant mortality, we have the highest rate of the rich countries. We have the lowest life expectancy of the rich countries, and everything in between. And it's sort of like, wait a minute, this is not just a problem of Black people. We just have it worse. And because we're treated so badly in society and in the healthcare system, that it's, made these American stats so bad. But we also treat poor people badly, of all colors. We also treat people of color badly. We're the worst, but other people of color get treated badly too. And all that is adding up to a huge crisis of health and healthcare in the America as a whole. I care most about Black people, but this is also an American problem. And I appreciated that my friend Steve, my white friend, said something. He's like, "This is an American problem. You don't have to shoulder this whole thing yourselves." And I think he was telling me yourself, but also yourselves. And it just was a light turned on to
Mhm.
me to say, "Oh, I didn't think about that. I didn't think about the kind of activism I needed to do as a journalist, and not just focus in on the Black community doing all the work,
Mhm.
but it's like everyone should, because this is a problem that is affecting all of us."
So do you feel like, did your work kind of shift more towards outward news sources
Yes.
after
Yeah.
that?
I definitely stopped doing, I believe in self-help and self-health.
Yeah.
I really do. I think we should all take care of ourselves. I think we should do the best we can for our families and ourselves. But it's also like when you look at these statistics, even if all of us try to do our best, it's not going to help if
Yeah.
our society is harming us. And in the very healthcare system that is supposed to do no harm is actually harming us. No matter what we do, it's not going to change those demographic statistics.
Right. Because no one, uh, just like Danielle, no one is really gonna know how heavily polluted their community is just offhand.
That's right.
Like,
That's right.
and no one's really gonna look up when they're moving, oh, how close is this to a chemical plant? Or how,
Yeah.
they're really, what you're saying is that if you want to live in a black neighborhood, you're basically running the risk of being exposed to something. And
And it's not it's also it's exposure, but it's also like in our communities that have been historically redlined. There just is less there. It's harder to be healthy. It's harder to have healthful environment. And I saw that in my mother's community. She's from Chicago. I was lived in Chicago till I was 10. And you look at the life expectancy in Chicago is people only live to age 60. I should be dead now.
right,
And where 9 miles north, they live to age 90.
right,
And so then you just go, oh, it's because of poverty. Well, yes, but how did that happen? So you look at what happened to make that community, which when I was growing up was not, we never considered our family poor. We owned our homes, and
right,
then I realized, oh, my family owned their homes through barely, hanging on to those homes
right,
because of redlining, which made the neighborhood look hazardous. So if
right,
a neighborhood is hazardous, it's hard to get a mortgage. Plus, if you're black in those days in the 40s and 50s, you couldn't get a mortgage. And so my family bought their homes on contracts. But if you missed a payment, you could lose your home.
yep,
Your home is the biggest source of wealth.
yeah,
It's what you sell to make money. It's what you pass down to your children to, keep the wealth in the family. And if black people couldn't own that, and you couldn't in Chicago, you couldn't in other places around the country, then we lose wealth. And health and wealth are connected. And so I was like, whoa, this is about poverty, but it's not as simplistic as we've been told.
yeah, yeah, because it really puts like a blanket diagnosis over the black community. You're like, access to this, access to that. They don't have this, they don't have that. This is why it's happening. And it's not like you're not seeing the full picture at
Yeah.
all when you just look at it like that.
Yeah, and we're always told it's our fault. We did something wrong. We
Yeah,
didn't take care of our communities. We didn't want to work, or whatever all the stereotypes of us as a people. And it's kind of like, well, you know what? If you look closer, these stereotypes are old
yeah,
and tired and came from capitalism and during enslavement, and
right,
then lasted and lasted and lasted because it benefited other people. And it's sort of like, actually, somebody was asking me about reparations. And I
yeah,
was like, I think 5 years ago, I would have been a little bit more like, well, I'm not sure. How would it work? Blah, blah. Now I'm like, oh my God, you could figure this out. If you look, you could start in the south side of Chicago, where my mother's from, and look at the damage that was done and the repair that is owed.
right. So do you think it's really worth like zeroing in on?
I think it's interesting. And I think that my work on eugenics and on forced sterilization is the easiest way to
Yeah,
do it because reparations are already happening. So,
right.
reparations happened in 3 states, Virginia, North Carolina, and California, to
Mhm.
give money to people, men and women, who were sterilized through the government.
Right,
Back in, I guess actually in California, it was much more recent. It was in in our generation, and
right,
it was in the past in other states.
right,
Eight states have given official apologies, and 3 states have paid money to people who were sterilized through by the government, but there are hundreds of thousands of people who were sterilized who still
Right.
have not gotten any repayment. And
Right.
that's, I was writing about the Relf sisters who were
Yes.
sterilized in the 70s.
Oh my
They're still
God.
alive,
Yes.
but you know what? There's a happy ending with those Relf sisters.
Yeah.
My story, it was an excerpt of my book. It ran in June. And I got this crazy email from this woman. She's like, "Oh, I saw your story about the Relf sisters. I live in Washington State and I have benefited, I'm white, I benefited from generational wealth, and I would like to do something for the Relfs." And I'm like, "Oh, what do you
Really.
want to do?" And she goes, "I want to give them money." And I said, "Oh, I'm me. How much?" And then she said $25,000. And I was like,
Wow.
"Oh," because that's the number that other states have given. And
Right.
then I'm like, "For each woman or just for the two of them, 25?" She goes, "No, 25 for each."
Wow.
So they got 20. This woman, she stuck with it. She pulled it together. A local activist on the ground ended up collecting the money and putting it in a account, and they bought a house and they moved out of public housing.
Oh my
I'm I know
God.
I'm going there to go see their new home and to bring them some housewarming gifts in a
Wow.
month. And I'm so happy for them. Because that one thing that I said, if
Oh,
you could, they don't really get repair or whatever. I said, if you had money, what would you do with it? And they said, "Oh, we just want our own home." And I
right.
said, "Do you want to live together?" And they said, "Yeah." They wanted a house together. So they ended up with this home. Apparently it has a garden,
Wow.
which they really wanted, in a yard so they could bring their family over for barbecue. So I can't wait to see it. But
Wow.
I think I'm really, I mean, that is not a solution, looking for individuals to, sort of do the repair that our country and our government should do. But hello, the Ralphs have a new home. So I'm happy. Those sisters,
Like what? That is
they didn't get their fertility back. They've never been apologized to by the government, the federal government, the state,
amazing.
or local.
Yeah.
However, they did get their house from a kind person. So I'm glad that happened.
And it's so like it's so wonderful when you actually do hear about the reconciliation, that just you being someone who is interested in this, like writing about it, like this is what they don't tell kids about writing and and reading when you're a kid. Like, no, if you write something, you can make something happen, and that's
Yeah.
a perfect example of that. Like, if you didn't write about their story, who they would just be sitting up in somebody's Section 8 house.
That's right. And the woman read it and she's like, "I want to give back." And she was so, like, so hesitant. And I was like, "Oh no, if you got money, give it to them." They want the money.
Right? We're not too proud. Like,
No, no, no.
yes, that's a like that is truly amazing. Because reading that was so heartbreaking. It was just like they never had a chance. I mean, their life had started literally outside, like not having a home, and the fact that they
That's
still
right.
had a home to like something to really call their own was just so
Yeah.
like, oh,
I mean, that they were sterilized at age 12 and 14, it was just so patently unfair and harmful. And but they just never understood that it was unfair and unjust. They just knew it made them unhappy and sad, and
right,
that something wasn't right. But because I tried to show them, I said, "Here, this is in a history book, this is you." And they
right,
were kind of like, "Okay."
like,
And "All right." But I think I'm really proud of them, and that they got what they wanted and what they deserved.
absolutely. That God is so good. Like that is amazing. Like they deserve that. They deserve
Yeah,
it. It's so rare you get to hear that
yeah,
somebody actually gets their due.
that's right.
And it's just like it really makes you realize that every single thing that black people accomplish in this country is like an absolute privilege, because
Yeah,
there is literally someone there have been people orchestrating things that we had no control over for generations and been telling us to our face, there's absolutely nothing wrong. What are you talking
yeah. I love gaslighting and the receipts, so thank you. I'm taking that. Yeah,
it's just like it really just it you really wonder, how weren't we crazier? Like
Yeah.
how weren't we just blowing up this country? How has this country just been able to run knowing that it would not run without us if we all decided to quit tomorrow?
Yeah. Yeah. I think one thing that my colleague Nicole Hannah Jones said is that we are the people who really are invested in this country and in making it better. So that when, I think she was talking about it in response to, sort of like this horrible backlash over critical race theory and the 1619 Project. And I think what she said was really true. It's that we're the people who are engaged in this. We're the people who are trying to change the country for better, not just for selfish reasons, but to say, are we, and we've stuck here. We're still here. We are still here trying to make change, and to make change, to make this country better. And I love when she said that, and she said that we are the most hopeful people and still believing that we can make a difference and change the system. And I like that.
Absolutely, because I think it was a line in the book like this, that this fight that we take on is like so far beyond us, like so far beyond our ancestry, so far into the future that we have no idea what is going to stop. But many of us take it up, and
Yeah.
you know take it up joyfully in some instances, like just to be a part of the collective progress is like it's motivating, and it's also like draining. It's
Yeah.
it's
No,
also
it is draining.
talked
Yeah.
to I recently talked to Dr. Naeem Akbar randomly on the phone, and I asked if he wanted to speak on, you had brought this up in the mental health chapter about how Black kids have suicide rates have risen from the 1990s when I was coming up, and the early 2000s, like all the way up to 2017, how our suicide rates have gone up. And I've been trying to plan this event for Black boys for a minute. And so I asked Dr. Akbar, like, can I, are you speaking anymore about this? Like, you wrote so many great books. And he's like, honestly, I'm done. Like, I've given everything I need to give. And everyone can, take my work and use it as they need to. But I'm spending time with my grandkids. And I was like, you know what? Please do that.
Mm.
You deserve rest. He's like, I've been
I
doing
love that. I think that's a beautiful act of self-care. We can all read his work and his books, and we can take from it. And I'm really interested in what's, the activism that's happening. And one of the happiest things I saw was when I was covering environmental justice. I remember, the activists that I was hanging out with were really intergenerational and interracial. And my favorite moment, they were going to this protest against this refinery, and I was like marching with them and recording everything and sort of interviewing people. And I was with the older Black people. So the young white folks and some of the young Black folks were in the front, and they were really wanting to get arrested. You could tell. They were like, "Oh, we just want to get arrested. We are going to really we're riled up, we're ready to go." And the older Black folks who were in, they're all the same organization. They were like, "I'm not getting arrested. Let the white people get arrested. I've done that already and don't want to be involved with the criminal justice system. Let them do it." And I just thought, this is what intergenerational activism and organizing is about. It's
right,
about what is your role in it? What is your part in it? And I kind of, I just really like that group. The other thing that happened was there was clearly the founders of the organization were the most well-spoken and the most media savvy. But what they did media trainings for
right,
other people who were from the community, who had some older, some had various disabilities, who hadn't spoken. And those were the people who generally would get left behind in the media coverage. But I saw the more sort of educated people and some of the white folks step right aside and put forward the people who had gone through their training. And it
right.
was really generous and really smart to do that. And I really like that. So I'm very interested in how sort of this, I don't want to say generation, this time period, how people are doing activism.
Yeah. And how we could do more of the intergenerational conversation behind it, because we're looking, I'm in looking even just at your work, like I showed you before, I have Body and Soul right here. And this book came out in what, 95?
94, 94, I think.
Yes, 94. And
Yes.
I was born in 93. So I'm a year older than this.
That's funny.
So it's like seeing this net like this is like, again, comprehensive health book that really goes into detail about what's going on with Black women, why, like, why it's happening to us, different uh tips and things like that. And then now you come to this body of work, like, it's kind of is this like a full circle moment for you? Like,
Yeah, I think so. And I just wasn't there yet. I was still into self-help, and I still
yeah,
am. I just want Black women to know, Black people to know what you need to do to stay healthy. But I also, and it's funny, I was on the cusp of that. If you look at Body and Soul, Angela Davis did the forward,
exactly.
June Jordan and Billy Avery was my mentor in
Yeah,
this. And these are people who are real activists. In a way, I was still sort of like doing self-help, but I was right there. And I think now I am, I like to talk about self-help among friends, but now I'm like, no, there needs to be a different kind of change. We need to demand change from our country and
yeah,
our world to say, wait, this is unequal, it's unfair, it's unjust. And that's why we need to do better, not blaming people and also putting the responsibility and the onus on individuals for what happens to us in this country. And it's a hard time to be talking about this. This is a time of complete divisiveness. However, I'm sticking to my little storyline. And somebody was like, well, you're just talking to people in the bubble. I was like, well, let's make the bubble bigger. Make it bigger and just keep talking to more people.
right. No, because, and I hear that, talking to people in the bubble. Yeah, we are talking to people in the bubble. Absolutely. However, I come in contact with real DC kids every day. Not every day. I work half the week in a DC school, but like, I'm a school therapist right now, and I'm
Mm.
seeing in real time what is going on with literally inner city Black youth. Like, the definition, the what is in our textbooks, what is in our research papers. And there is still a very much so a need for self-help and information that needs to be disseminated to, Black teens, like Black youth in general. Like, absolutely, there is like a disconnect in terms of certain information that we should know at an earlier age. And so, like, in me knowing that, I know that I'm also a writer, so I also want to publish books, and I will actually be a publisher as well. So it's like, I want to write the pick up where you left off in terms of like the body and souls and the things like that for Black families, um for Black teens, Black puberty books. Like, I used to work at American Girl. American Girl sells a dearth of books for white girls about every single
Wait,
topic.
American Girl, the dolls?
Yes. 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 Yeah. So me coming up, my mom was like, I'm not about to pay for no $100 dolls. She's like, no. But they did buy us the books, and the books were
Uh,
like, they had a puberty book called The Care and Keeping of You. They had um like books for talking to boys, like books for communicating with friends. Like, they had everything you can think of that represented the average white girl. And
mhm.
they had a little, maybe one little animation of a Black girl somewhere in the corner of the
Oh my God.
book. But it's like that. I ended up working there after undergrad and literally seeing in real time little Black girls choose little white dolls every
Yeah.
single day.
Well, you did choose the white dolls because I mean I could see that. I took my kids to in New York they have the American Girl store and they have a theater. So my mom and I took my children, her grandkids, to the theater, and it was
Mhm.
like showing the little sort of narratives of the different dolls. So it was like all the white dolls was like, I'm going to be a journalist, I'm doing this and like this, and it's like Addie is being chased by dogs. She's enslaved, and I'm like, oh my god, who'd want to be Addie? This is terrible. And so I'm like, please, someone take me to the more modern black dolls, because
Right,
this is, my kids were like,
right.
hyperventilating. It's like, whoa, I just want to be one of the nicer, like the little journalist dolls seem cool.
I will say they have actually done a lot better recently.
Okay, good.
They have done. There's a new doll. There's a one because Addie actually represented emancipation. So
Yeah.
she was escaping slavery at the end, and then
Yes.
the Emancipation Proclamation happened. But they added another doll in 2016 or 2015 that represents the Motown era, and her name was Melody. And they talked.
Okay, good. Thank you for that update, because I was like, ooh, I'm getting off these dolls. I freaked out. Um,
They did a better job with the
yeah,
but I say all that to say that, we do I feel like we do still have a responsibility to educate ourselves, but at the same time call out what has been ignored for the last hundreds of years, that this is
yeah,
absolutely intentional, and that not all of this is your fault. Not all of this is your responsibility, but these are things that you can do to ease in the meantime.
yeah. And I think what I really appreciated, I mean, I have it to some extent in my book, but really with the 1619 Project was that our charge wasn't just to look back
Mhm.
and look at all the horrible things that happened to us as our ancestors as enslaved people in the United States. It was to look at what's still happening based on the through line. What was the through line? And for me, it was the idea that Black people, the myth that we had superhuman pain tolerance.
Right.
And so, you looked at it, you saw it with Dr. J. Marion Sims. That's why he felt okay to do these surgeries without anesthesia on enslaved women. And it was very funny. Somebody goes, well, wow, you must have had to do a lot of research to find out about that. I was like, I did no research. I got the guy's book. His book, Dr. J. Marion Sims wrote a book called My Life, and detailed, he
Right.
said, he talked about how that women were in such pain that they had to hold each other down, because while he was doing these surgeries, but he didn't see anything wrong with it because of the myth that we have superhuman pain tolerance. Then you fast forward to 2016, and there was a survey from the University of Virginia that was looking at 222 white medical students, and 40% of them, and these were not just first, second, third, fourth year medical students, but also residents, the next year of training, who believed at least one myth. And one of the myths was that Black people have intolerance to pain, could endure pain that a white person never could endure.
Right.
And that's in 2016. And then in 2019, there was a similar study, and it was about cesarean sections.
Mm.
Obviously, a C-section is major surgery. You cut open your abdomen. And then, in the survey, it was the assumption that Black women could endure more pain because we felt it less. And a C-section for anyone is major surgery.
Right.
So to have the doctors that are OBGYNs that believe these myths in modern day is frightening, but it's based on this old myth.
Right.
And I had never been, like, I'm more of a journalist in the here and now.
Yeah.
So looking back at this history was really shocking. But then looking back at the through line to the present was difficult.
Yes, because it's really like you paint the picture from then and now, like right next to each other, and it's as clear as day. It's been this way for years, and they've just been lying and gaslighting and continuing the cycle, rinse, repeat, and
Right. and not acknowledging that, what that our medical system isn't inherently unfair, that people are human beings who come into the system, who want to, nobody goes to be a doctor, a nurse, a midwife, or whatever, trying to hurt people. They want to help people. But if
Right.
you go in with unexamined discrimination that is just part of our society in America, then you can never be, your best self as a medical provider, even though you want to be. And
Right.
Black people are not immune to this. Black medical providers, we come in with the same kind of biases. Maybe it's not against skin color. Maybe it's about class. Maybe it's about accent. Maybe it's about religion or national origin. So all of us, like have to examine this. But white people make them up the majority of physicians, and though that's where the power is, and hospital administrators, and medical school educators. So we have to, push them and challenge them to do better.
Absolutely. I didn't see a black doctor until I moved to DC. I'm from Jersey. Like,
I get that. I get it.
so it's just it's a real problem, and our lack it goes across fields, across the mental health profession. I'm like one of the 3% of black therapists that is that exist,
That's right.
and it's ridiculous. I had actually I had a before I had applied to Howard's MSW program, I applied to UMD's MFT program, and I got to the interview, and the director at the time, a older white woman, she was actually on her way out, but she still did my interview, and she was like, I read in your essay that you know there's such a lack of black therapists, and that there's 3% of black therapists, and that you as a black therapist would relate better to the black people, but don't you think that black people might take advantage of the fact that you're black in a session? And I was like, what? Like, I was like,
God, there's so much to unpack there. Like the obvious question is, don't white people take advantage of each other when they're okay? But okay. Um,
I'm just like, first of all, what are you trying to say to me right now? Like, what exactly are you trying to say? Because basically how I responded to her was that no, because at the end of the day, I know what's going on in the black community before you would know. I'm
yeah,
uh you would have to ask what happened today in the black community, whereas I already know what happened. I already have heard 15 conversations about it, and somebody coming into my session that wants to talk about what's going on with Kyrie Irving, I would know.
that's right.
So it's like, don't sit here and ask me if they're going to take advantage of the fact that I'm black. It is an advantage that I am black. Don't to question my blackness as a reason not to make me a therapist. Like,
Yeah, that's ridiculous. And I think that the point is there's been a lot of research that says that people are more comfortable with healthcare providers when they have something in common with them. And it goes both ways. Healthcare providers are better with people who they feel more comfortable with. So it makes sense, but it is even more important with emotional, behavioral, mental health, because it's easy to avoid. If you are a black person, we're all trying to avoid the healthcare system because we've been treated badly. Then you really want to avoid the mental health care profession, because you don't want to go in and be vulnerable and tell your truths to someone who you're afraid won't understand you,
yeah,
and actually may not.
yeah,
And so that is scary. Plus, I think part of it is on ourselves, where the myth is that we're all strong, and invulnerable. And we've had to be that way to survive in this country. So to admit that you have vulnerability emotionally is hard for us. And so if you are, like I have been literally with a white, mental health care provider who's like, well, you're so strong. And I was like, I don't want to be told that. I
right,
want to be able to not be strong
right,
here in the privacy of my, so
right.
now I'm very careful with who I choose.
Absolutely. It's so hard. I now have encapsulated myself in the chocolate city bubble, but outside of here, I remember like I said, I didn't see a doctor that was black till I came here. And so the rest of the country is now living how the DMV is living, and having all these excess of black professionals in the area because of Howard University, to be frank.
Yeah.
So it's like I am privileged to even have the choice of many black providers in the area, and have the choice to be picky about my black providers, whereas people can't even find a black provider.
Yeah. Well, it's interesting. This semester at City University of New York, I taught pre-med. I just finished. And so I have, these pre-medical students, all people of color. And I know how hard it is to get through medical school. And these are kids are pre-med. They're not even starting their actual medical training yet. And I can see the issues that they're having to deal with even then. And I'm just thinking, I am so glad they're at a protective space, like an HBCU is a protective space. Howard Medical School or Fisk or any of the black medical schools, but also our college, which is predominantly people of color, is a protective space. And I saw I asked to sit in on a mentoring session it was black male medical students and black male doctors. And it was the medical students had a conversation first, and they were all like completely had dropped any code switching. So they were just talking to themselves as, classmates and everything. Then you saw the black doctors come onto the screen, guys who had been through the program. Oh my God, it was so beautiful to see them, these brothers in their white coats and coming in. You could see the clinic in the background. You could see that these were successful guys. Everybody was just talking as though, I was just like a little fly on the wall, as though no one else was listening, and hearing them talk to each other and share their concerns and really mentor each other I thought was beautiful. And, I obviously believe in not individuals being responsible for everything, but I thought if this is institutionalized, someplace where there's not the assumption that, oh, you can just get through medical school without help. It's like that this kind of mentoring is part of the institution. It's part of the process.
Yeah.
Would be just so amazing.
Right. Because like at the end of the day, black schools graduate more black students, period. And it's for a reason, because we are going through it all. I was at Howard again, and there were bomb threats. And
Yeah.
like
I know.
and it's just like I think I was, ambivalent toward it because I've been living in DC so long. So it's like it kind of comes with the territory living here. But we are a black school that is getting bomb threats in 2021 and 2022. Like
Yeah.
race, like, and y'all telling me racism don't exist? Like, please stop.
Yeah. Gaslighting. Well, I think that part of the thing I wanted to do, and my computer's dying. We better. Okay. But part of the thing I wanted to convey in my book was that we as a country, there are solutions and there are good things happening around the country. One of the things that I find the most exciting is at medical schools, where you have medical students who are not listening to sort of some of the outdated notions, who are pushing back against them. And many of these are Black led or people of color led around the country. And I think this is really exciting. And some of them are saying it's hard to push back against your professor. I'm a professor. I don't like when the students talk back, but but I think pushing back against your professor with data and with information and saying, wait, this actually in this medical text is outdated. Black people do not have lower lung function. That is left over from the days of enslavement. I am not going to learn this. I'm not going to use outdated instruments or measurements in my medical practice as a doctor, as a incoming doctor. And I am so excited to talk to medical students, to listen to how they're pushing back, to listen to how they're strategizing with each other to make changes in medical school. I am excited there's a lot of schools that have started some kind of health equity, institute or center to talk about these topics. Government agencies have changed. I think when I first started writing this book, Under the Skin, I would never have called racism a public health threat. I would
Mm,
have said, like, oh, there's discrimination in the system or there's a problem. And something has changed. That conversation is much more open.
right.
And I think there is, somebody was like, I was talking to somebody and they're like, well, there's a lot of pushback. I was like, the train's out of the station. This is already happening. It's
Yeah.
happening in medical schools. It's happening in health agencies. It's happening in discussions around the country of real people like us saying, wait, we've experienced something that's in the healthcare system in our society that's harmed our health and it's not our fault.
Absolutely. Thank you so much. Thank you for your work. Oh, like this is 30 years right here. Right here. How's this 30 years? I had too many books. But yes, yes.
Well,
30
thank you for this conversation. And just this is a side note, but I want to talk to you a little bit more about your experience in as a educator in DC. So that'll be our side conversation. But I've loved this, and thank you everyone who tuned in to hear about this. It's really important, and to lift up the stories, our stories, and also to lift up those who are trying to make a difference. And I appreciate you. I love your bookstore. I'm gonna come.
Thank you. We can't wait. We can't
Yeah.
wait. Thank you so much. Good night, everyone. Thank you.
Thank you. Good night.